Good afternoon, ladies and gentlemen. Welcome to the white coat ceremony for the class of 2014. It was a pleasure to meet many of you this morning as we had an orientation session for the students and families. This is the formal welcome for this class, for your children, important others, to the profession. This is an opportunity for us to tell them that they are part of the profession now. And unless they do something that's genuinely inappropriate, they will stay part of the profession. We intend to treat your children, your important others, your spouses with dignity and respect, even though we will demand much from them. At this time, I would like you to please rise and welcome the class of 2014. Please be seated. Now that we have the class of 2014 with us, welcome to you as well. This is your formal induction, if you will, into the profession. Your parents have these little souvenir programs out there that you'll get to see later. In here is the story of what this white coat symbolizes. The white coat symbolizes the spirit of a contract of trust between society and the healthcare practitioner. In part, healing reflects the trust and confidence of the patient in their chosen doctor, whether dentist or physician. Donning the white coat is symbolic of entry into the health professions and the sensitivity to aseptic conditions. The white coat also implies a special knowledge attained at great personal cost in time, study, resources, and duress. The white coat is also seen as an affirmation of life, as opposed to the black coats of the 1800s physicians and their waistcoats when they attended the deathbed and during the times of the Black Plague. The universal connotations of white include innocence, purity, faithfulness, safety, and more. And this is so in Judaism, Buddhism, Islam, Hinduism, Christianity, and other world major religions. White in Latin is candor, a safe and comforting quality patients very much seek in their doctor. The white coat also conveys the contract between patient and doctor, often reduced to written permissions today, granting the caregiver the privilege to touch the patient as part of providing care. Respect these sacred trusts. Look and act like the doctor you would want to care for you and your family. Never act in a manner which would darken or damage this symbol of all that exists between us and our patients. Welcome to the health professions. Wear the white coat with respect and humility. At this time, I would like to introduce our Dean, Ira B. Lamster.
Well, good afternoon. Today's ceremony marks a transition for you and certainly for your families, as well as for us. Today, we officially welcome you to Columbia University, to the Columbia University Medical Center, and to the healing profession. The tradition of the white coat, as you just heard, actually began here at Columbia at the College of Physicians and Surgeons, and it's been adopted by most medical schools and some dental schools as well. This is the 15th year that we here at the dental school have had our white coat ceremony. Dental and medical students have traditionally been welcomed to the profession at the time of graduation. I want to point that out, at the time of graduation, 4 years from now. Today's ceremony changes that concept, and by welcoming you to the profession at the beginning of dental school, and recognizes that professionalization and professionalism begins as you begin your training, as you take on important responsibilities, and as you become someone who is responsible, responsible for the care of others. The academic world is filled with customs and ceremonies, but this event has more significance than others. The white coat ceremony welcomes you when you begin your healthcare career, not when you end it. This is more than just symbolic. Rather, it is a pact between us, between the faculty and between the students, that we are professional colleagues. I hope that you leave here today with 3 thoughts, and that these thoughts stay with you throughout your professional career. First, dentistry and medicine are healing professions and have been given certain special responsibilities by society. Second, you must learn what society expects of you in that new role. And third, you have the public trust. And let me just speak briefly about each of these points. First, the specialized education that you receive is given to no one other than dentists, and that because of the specialized knowledge, the public allows us to regulate ourselves. We regulate ourselves. While society sets certain boundaries, this is nonetheless a tremendous responsibility and implies, obviously, a pact on our side. Second, how does one behave as a professional person? There is no single course that teaches that trait, though you will receive a 4-year curriculum in ethics and professionalism. These seminars emphasize situations in which there is no correct or incorrect answers, and I think Dr. Davis and I will begin that process with you tomorrow. But rather, you're presented with situations. It requires more than basic knowledge of science or of clinical care. Really what it requires is professional behavior. And I think it's important for me to emphasize that compassion and an ethical compass, certainly a properly set ethical compass, are 2 traits that will serve you well. Lastly, if you achieve the public trust, society will reward you with a special place in the community. And as evidenced by opinion polls, you as a dentist will be viewed as particularly trustworthy by the public. The process of becoming a professional person is dependent in part on the curriculum during the next 4 years. You will also learn informally, really what is the extended curriculum, by watching your instructors in class, by attending professional meetings, and interacting with professionals both within the dental profession and outside the dental profession. We believe the environment here is particularly well suited to develop your sense of being a professional. The donning of a white coat is a statement by us and by you that you have entered a new stage of your life. Your responsibilities have increased, and you are viewed differently by family, friends, and the community. This is a journey, and we certainly welcome that we are taking, or very happy that we are taking the first steps with you. Congratulations, and again, welcome to Columbia.
Thank you, Dean Lamster. This time, I'd like to bring up someone who I have known for a long time, who attained her DDS here, her pediatric dentistry training here, her orthodontic training here, and is currently serving as the president of our Association of Dental Alumni and has offices here in Manhattan, Dr. Margot Jaffe.
It is my pleasure today to speak to you on behalf of the Columbia's Dental Medicine School and the Alumni Association, and personally welcome the class of 2014 into our Columbia family. Additionally, I want to thank the families who are here to support and send their emerging adult children off on an exciting, educationally challenging, and ambitious endeavor. You represent the best and brightest college graduates. The pathway is arduous, but the process and wealth of knowledge that you will acquire in the next 4 years will be well worth the effort. We are excited to participate in your graduate education. Our alumni are active in every facet of the school, in teaching, mentoring, admissions, career placement, research, long-range planning, publishing, lecturing, global outreach, fundraising, etc. These activities maximize your learning experience and fulfill the school's vision and mission statement to produce ethical, productive, and highly competent dentists. The Alumni Association is your advocate and is here to support you. Good luck.
By the way, Dr. Jaffe does know what she's talking about. She's on the admissions committee. Some of you were interviewed by her, so she speaks of what she knows. Next, I'd like to bring forward someone who also is an alumnus of the school, who has a fabulous practice in Midtown, who is actually the chairman of the American College of Dentists for New York. The American College of Dentists is an honorary society. You have to be nominated by several of your colleagues. You can't ask to join. The people who are elected to the American College of Dentists are those who are the best and the brightest of the profession, and it's a national organization. And Dr. Roberts is the chairman of the New York section. Jonathan?
As chair of the New York section of the American College of Dentists, I would like to welcome all of you to this very special event, the White Coat Ceremony. We in the American College are very pleased to be able to support this event. It is really my personal pleasure to welcome you, the students of the class of 2014, as my new professional colleagues. I would also like to welcome the parents, without whom there would be no class of 2014. Let me take a few moments to share the American College of Dentists with you. The American College is the oldest national honorary organization for dentists. It was founded in 1920 in response to serious problems facing the profession, not unlike many of the challenges that we face today. It was a group of visionary leaders who believed dentistry must look beyond today and plan for the future. The college is comprised of dentists who have exemplified excellence through their outstanding leadership and exceptional contributions to dentistry and society. Membership, as Dr. Davis mentioned, is by invitation only, using a confidential peer review process. About 3.5% of the dentists are fellows of all dentists are fellows of the American College. The mission of the college is to advance excellence, ethics, professionalism, and leadership in dentistry. Many of your deans, administrators, and teachers are fellows of the college. Your charge today then becomes one of being a professional. As of today, you will be held to a higher level of ethical and professional behavior. Do not assume that simply sitting back and being a participant makes you a true professional. We do not simply exchange goods and services. A true professional places patients' interests first and foremost, respects patients for their unique needs and values, has integrity, is honest, is competent, strives to improve personally, strives to improve the profession by giving back through teaching, involvement in professional groups, the community, and yes, even financial support. But above all, a professional is ethical. Without high ethical standards, you cannot be a true professional. A lifelong process begins today. I look forward to joining you on this journey. Thank you.
I want to just take a moment now, since Dr. Roberts has spoken to you, acknowledge who's supporting the luncheon today and the activities of the day. It is the American College of Dentists. It's also Procter & Gamble's Oral Health Division, and they have a representative with us, Rebecca Van Horn. If you just stand up so they can see who you are. We very much appreciate the help of these two organizations in having this event. The keynote address to you is brought by Dr. David Albert. Dr. Albert has been on this faculty a good long time. He's actually older than he looks. He has been someone, however, whom I have seen personally stimulate our students to think, whether discussing what causes cavities, caryology, why smoking is a really, truly public evil, and how to help patients get over it. Many other things, understanding what third parties do, how the insurance companies can or might want to affect what you do for your patients and the relationship you have. These are all part of the areas he covers in the curriculum. So trust me, class of 2014, you will come to know Dr. David Albert. It is my pleasure to introduce him to you as the keynote speaker for our white coat ceremony today. Thank you.
Thank you, Dean Lamster, for the invitation to speak today. Dean Davis, thank you for your kind introduction. Good afternoon and welcome new students, your families and friends to Columbia University and the College of Dental Medicine. It is an honor to be here today to speak to the first-year class about the white coat tradition. As you begin dental school, it is worthwhile to reflect upon why you have chosen dentistry as your career. You no doubt recall your essay when you applied to dental school. Remember the section where you described the reasons you want to be a dentist. My advice to you is to go back to that essay and copy that line down. Put it in your wallet. Periodically read and repeat that line. It is no doubt the essence of what you are trying to achieve as a professional. Hold that thought and apply it to your patient care. Use it to set a standard that you never stray from. Maintain that bond with your patients. Never go astray from the path, and you will fulfill the goals you've set for yourself and your obligation to your patients as a dentist. The trust and the professional relationships that you establish with your patients will change you. The white coat represents many things. Dr. Arnold Gold established the white coat ceremony, as the dean mentioned, here at the College of Physicians and Surgeons back in 1993. He stressed that the ceremony should transmit the message that doctors should care as well as cure. It represents both great opportunities and great responsibilities. The enveloping with the white coat is an experience that underscores the bonding process you will have with the professional community and the obligation you have to your patients and society. First, congratulations on your acceptance to the Columbia family. As you start your first week at the College of Dental Medicine, you join a distinguished group of alumni who, like you, entered the halls of the College of Dental Medicine for a 4-year trek that will educate and fascinate you. Embrace the education, as there are many, many opportunities to learn and grow at this esteemed institution. These are 4 years that will shape your future and set the foundation for your professional careers. You are embarking on a journey that will allow you to become a dentist and a full member of the profession. The ceremony is intended to impress upon you the importance of the doctor-patient relationship. It encourages you to accept the obligations inherent in the practice of medicine and dentistry, and emphasizes the importance of compassionate and professionalism in your lives. Some of you may be wondering if you have what it takes to learn all that is required to be a competent dentist. All of you have exceptional credentials and were chosen because your abilities would lead you to succeed and excel within the dental school environment. Your undergraduate college performance has been outstanding. The class is quite diverse. Some of you will have already obtained advanced degrees, while others have been involved in research or in industry and business. The exceptional new curriculum at CDM is designed to train you to be an exemplary dentist and outstanding clinician. You will be well prepared to pass the national boards and to show proficiency on your licensing boards. Through the excellence of its graduates, the College of Dental Medicine builds its reputation. The accomplishments of our graduates are renowned. The performance of our recent graduates in postdoctoral education programs, and these include advanced education and general dentistry programs, general practice residency programs, oral surgery programs, orthodontic programs, public health programs, pediatric dentistry, endodontics, and prosthodontic programs. All of the performances of our students in those programs are exceptional. Because of the consistent quality and excellence of our graduates, programs will seek your applications. CDM is the leader in postdoctoral education acceptances in the United States. As you don your white coats, never forget that you will be setting the standard for the profession and yourself. Never accept mediocrity. Set the standard. Columbia graduates and faculty have set the standard for the dental profession. Many of you will also become renowned as clinicians, academicians, researchers, and leaders who will change the face of dentistry and the direction of healthcare. Thank you. I want to take this opportunity to mention several Columbians at the College of Dental Medicine who have changed the profession. There are many, many like them. You too can aspire to lead and change the profession. I want to start with a biochemist here at Columbia named William Guise. He was a remarkable Columbia biochemist and researcher. Dr. Guise was interested in dental education, science, and clinical applications. In 1926, as part of a series of studies on professional education in the United States, funded by the Carnegie Foundation for the Advancement of Teaching, Dr. Guise published a landmark report that established the importance of dentistry as a healing science and as an essential component of higher education in the health professions. The Guise report, Dental Education in the United States and Canada, took 5 years to research and write. It consists of 250 pages of text and more than 400 pages of appendices. Dr. Guise visited every dental school in the United States in writing this report. The dental education system that you are entering today was in large part shaped by the Guise report. Another graduate of this school, Dr. Erwin Mendel, graduated in 1945. He established the gold standard for research and teaching and shifted the focus of dentistry from repair to prevention. He has authored more than 200 scientific articles and 17 books or book chapters. He conducted pioneering research on the role of dental plaque in tooth decay and periodontal disease, and is also known for studies of salivary composition as it relates to dental disease and systemic disease. He won the American Dental Association's Award for Excellence in Dental Research in 1985. When he retired, he was the CDM Dean for Research. I met Erwin in 1987. It was his career and inspiration that led me to Columbia and into academics and research. You will find many inspirational faculty members at this institution and within the other schools of Columbia University. The last graduate of the school that I want to mention is a dentist named Dr. Lawrence Tabak. Dr. Tabak graduated in 1977 from the College of Dental Medicine. He has been at the forefront of dental research since his student days at Columbia. Currently, he's director of the National Institutes of Dental and Craniofacial Research at the National Institutes of Health. Dr. Tabak has published extensively on the structure, biosynthesis, and function of salivary mucins, the pathogenesis of salivary gland disease and dysfunction, and the use of saliva as a diagnostic fluid. Just last week, Dr. Tabak was appointed as the new Principal Deputy Director of the National Institutes of Health. Last year, he oversaw the dispersal of NIH's $10 billion in stimulus funds. All remarkable accomplishments. For me, I am the child of immigrants to the United States. My parents came to this country of refugees and survivors of the Holocaust from Europe following World War II. For them, the health professions, particularly academia and research, were the essence of the American dream for their children. I came to the College of Dental Medicine in 1987. I have had a rewarding career that has been a blend of practice, teaching, research, and community leadership and activism. My clinical practice is part of the New York Presbyterian Hospital, where I am the medical and dental director of a comprehensive geriatric clinic. It is a practice model that I hope we will see more of and need more of in the future. The complex medical histories and the prevalence of polypharmacy to treat chronic diseases in the elderly make integration of medical and dental practices sensible. We are able to do this here at Columbia and our hospital. There are times when you will practice and provide a service that has a profound impact on a patient's life. You will acquire skills over the next 4 years to diagnose and treat the oral health and improve the overall well-being of your patients. I would like to describe a recent case in my practice as an example of the impact you can have on a patient's life. The case involved an 85-year-old patient who had suffered from chronic headaches for most of her adult life. She never smiled during her visits and expressed the discomfort to me repeatedly, as well as to her physician, social worker, and psychiatrist. I remade her partial dentures, but this had no impact on her chronic headaches. She was referred by her physician to a neurologist who, after extensive testing that included CT scans, ruled out neurological reasons for the chronic headaches. At her periodic examination, I decided to fabricate an occlusal night guard. The wear on the patient's teeth did not appear to be the result of bruxing or grinding, but rather from a lifetime of normal attrition and wear for an 85-year-old. During a follow-up visit with her social worker, I was called on the phone and informed that the patient had come in and her pain was gone for the first time. She was smiling. The night guard had worked. At the patient's next visit, I was given a bear hug from a grateful patient, and you'd have to see this patient. She's about 65 pounds and about 4'10" in height. And to get a bear hug from this patient made my day, made my month. You will experience many treatment successes like this. To be successful with difficult cases, it is important to constantly inquire and to explore all the options available to you. This will build your treatment acumen and give you the confidence to build your professional career. At other times, treatment successes can be very, very difficult. How to handle these difficult cases and manage the patient will be a challenge. I am currently treating a longtime patient who was diagnosed with leukemia. She is 72 years old. Following radiation and chemotherapy, she developed oral mucositis, a painful condition that is very difficult to treat. The patient has lost a lot of weight and she cannot eat well because of the pain. The only treatment for this condition is palliative. The patient comes to me expecting an answer. Why do I have this pain? Can't you make it go away? I have consulted with her oncologist. I have battled with her insurance company to cover the lidocaine elixir that I want to prescribe to palliate the pain. However, I cannot make the situation better. I respond to calls from her children and social worker asking me why I'm not able to make her better. These are the difficult cases that require you to call on all your professional skills to provide guidance for your patients. You reach down and provide empathy and understanding. However, in some situations, you cannot provide a cure. I will see you this year as course director in my Cardiology Dental Infectious Diseases course in January, and in my oral healthcare delivery course in the third year. My research focuses on clinician and dentist adoption of guidelines in practice. At CDM, you will be encouraged to be inquisitive and question the science and guidelines that the profession and oral health infrastructure are established upon. In my oral healthcare delivery course that I teach with Dr. Carol Kunzel, a behavioral scientist that you'll get to know over the next 4 years, I encourage students to question the basis of treatment. Plato said, all opinions without scientific base are useless. As you start your careers, always examine the scientific basis of treatments and practices. It is through your inquiry and questioning that practices develop and mature and the profession moves forward. When you are seeing patients 10 years from now, they will expect that you are practicing according to 2020 guidelines, not the 2010 guidelines you learned at Columbia. Don't forget the importance of setting the standard that I mentioned earlier. Continue to be inquisitive and establish yourself in a pattern of lifelong learning. The great philosopher Whoopi Goldberg stated on her show, The View, if you are not taking care of your mouth, then you are not taking care of your whole body and it will kill you. Unfortunately, in the United States, many Americans do not have access to dental services. Part of being a professional is community service or volunteering. Give back to your community. A remarkable effort was started several years ago by dental and medical students at the College of Dental Medicine and in the Physicians and Surgeons College. A student-run volunteer clinic in Central Harlem was established to provide services to the homeless. Many of you will traverse the world to obtain experiences treating patients in countries in need of oral health care. Use the skills you learn here at Columbia and in your varied experiences to improve the oral health of your communities. I would like to finish with a quotation from President Obama that he delivered at the University of Chicago School of Medicine. It's only when you hitch your wagon to something larger than yourself that you will realize your true potential. You will look back on your years here at Columbia with fondness for the knowledge you garnered and cherish the many interactions you will establish with your faculty and peers. I wish you success in your training and in your life as a dentist. You are the future of the profession. Thank you.
Thank you very much, Dr. Albert. A couple of notes at this point. Two things are being presented to you as well when you come up for your white coats. One is a pin for the College of Dental Medicine that you can wear on your white coat or other attire if you wish. And the other is from the Alumni Association, these tote bags. The people who will present you these up here, Dr. Lorene Zubiari for admissions will present the pin, and Dr. Renee Litvak, who is class of 02 here, DDS class of 04, and Dodontics, will present you on behalf of the Alumni Association with these bags. I'm going to bring up the members of the class 8 at a time. Just step forward up to the edge of the stage. I'm going to introduce now the people who will present the coats to you, help you put them on. Now, I know the parents would like pictures. We're going to keep them all up here at the end so you can take pictures, other than stepping on each other in the aisleways or maybe tripping the people coming to get the white coats, because it's a little tight for that here. So if you can kind of hold off on the photographs till the end, we'd appreciate it. As I call your name, please, if you will, the coat presenters come to the stage here, beginning with our Vice Dean for Academic Affairs, Dr. Letty Moss-Salentine. Dr. Ronnie Myers is our Vice Dean for Administrative Affairs and in charge of our clinical operations. Class of 79 with Dr. Roberts. Dr. Margot Jaffe, whom you have met, our Alumni Association President. Dr. Dennis Mitchell, who also has the MPH degree, is a Senior Associate Dean for Diversity and Multicultural Affairs. Dr. Madeline Ginsberg, Assistant Clinical Professor of Dental Medicine. Dr. Jonathan Roberts, whom you have met, again a classmate, class of 79 of Dr. Myers. And they still speak to each other. Dr. Shantanu Lal, who heads our predoctoral pediatric dentistry, 05, and also did his pediatrics here. Dr. Lal. If I could have Dr. Zubiari and Dr. Litvak. And one more coat presenter, who is the course director of the Dental Anatomy and Occlusion course that you will be in this fall, Dr. Stanley Freeman. I promise to do my best to pronounce your names. I have tried mightily to understand that and not mess them up. Please forgive me if I do, and parents, don't hurt me. The first 8 individuals: Avi Amsalem, Yaakov Baruch, just step straight forward there in front of the presenter, please. By Austin Bai, Aditi Bharat Kumar, Abby Brecker, Lance Carter, Alejandro Castaño, Jose Castillo. Thank you. Come off to the side and receive your pin. Wing Chan, Brian Chung, Wesley Choi, Alexandra Delfiner, Brandon Duncan, Shannon Eddy, Josh Eli, Tamer Eshra. Scott Ewing, Andrew Ferraro, Sean Francis, Atsushi Fujimura, Kevin Fermanic, Austin Gall, Laurent Gamze, Grigory Gelfand. Bahari Goshayeshi, Jeffrey Hajibande, Zachary Hirsch, Tina Jung, Victor Kagan, David Karwacki, David Kim, and Hyung Kim. Sky Sul Kim, Wei King, Vasilios Kostakis, Sergei Kuznetsov, Kimberly Leal, Andrew Lee, Jiwan Lee, Ryan Lemke. Gita Lerman, Elena Lee, Guang Li, Vivian Lim, Rachel Lipsky, Michael Latucci, Imad Malay, Theodore Mahalik. Tefzet Mesfin, Lydia Mohavedian, Denise Moy, Sehun O, Brendan O'Rourke, Oman Lego of Bude, Angelina Peck, Kimberly Pappas. Vanessa Pasco and friends, Samantha Reyes, Alexander Rubinoff, Jeffrey Riba, Pasha Shakuri, Michael Shapiro, Marina Shirova, Reuben Sherman. Philip Shin, Dana Salaji, Joshua Stefan, Joseph Stern, Ina Sidorak, Bjorn Thorsen, Ying Wan, Joseph Wang.
So far, all the thanks to huh?
Kun Wang, Cindy Wiesenfeld, Joshua Wolgamuth, Bethany Wong, Jake Wong, Andy Zheng, and Jessica Zilo. Thank you, coders. Please be seated. Unless I'm mistaken, all the coats actually fit this time. That's pretty good. Because we're making wild guesses, having never worn one of these before, right? Congratulations to the class of 2014. And now the person who almost knew to stay here, I will call our Vice Dean for closing remarks. Vice Dean Letty Moss Salentine, DDS PhD, who I'm sure has real words of wisdom.
And to think Dr. Davis was one of my students. All right. The Dean and I have a gig. He has opening remarks, I have closing remarks. We seem to do this very well. In this ceremony that we have just had, there is a great deal of symbolism. We have welcomed you, as we have said, as the newest professors, the newest members, never mind, of the dental profession. This will take a little longer, okay? This is a trusted profession, as was symbolized by the white coat, which has a distinct code of ethics and rules of behavior. And so, as of today, in a very real sense, expectations of your behavior have changed. May not feel that way yet, but they have. Your medical colleagues take a centuries-old oath of Hippocrates. And in many ways, the promise you have made, or you will make actually tomorrow, is modeled on that oath. In a real sense, by entering a healing profession, you have now stopped being a member of the general public. You are assuming important duties along with the privileges, and they are good privileges, that come with being a member of this profession. And these duties begin this week. First and foremost, your actions from now on will be centered on your future patients. And as we kind of laughingly reminded ourselves this morning, until now you have studied in a self-centered manner. You may have hoped to pass a course by cramming, or you may have done just enough to squeak by. But now you're no longer studying for yourself. You owe your patients a dedication to learning, both the theoretical basis of dentistry, the biomedical, social, behavioral, as well as the clinical sciences, and the clinical skill to become the best practitioner possible. To work just to pass a course is no longer acceptable. And so this means that the college student's question, how much am I responsible for, question mark, is now irrelevant, since it can only be answered with everything. No patient wants to be treated by a dentist who considers a level of 65% knowledge or skill adequate. You wouldn't, I wouldn't, your patients will not. You owe the patients lifelong learning to maintain your skills in the best way possible. In the near future, you will find that you owe your patients your complete dedication in time and effort, even if that may be inconvenient for your personal schedule. You are now expected to behave professionally and according to the ethical code of conduct of your profession in your personal behavior, as well as in self-policing activity that the profession requires, as will be explained to you tomorrow. Today is a joyful day. We had great pleasure putting the white coats on you. You've just become the youngest members of our profession, our most junior colleagues. Welcome.
And she's still as good a teacher as she was when she straightened me out. So be aware of that. Be ready. Thank you all for coming to our ceremony today. As I said, we will now ask all of you in these new white coats, if you'll assemble up on here. Mr. McAndrew, who is our AV chairperson, if you will tell you how he wants to set you up for photographs. And friends and family are welcome to take photos as well. Please no elbowing, punching, hitting, kicking, or biting. I am a pediatric dentist, and I will stop you. All right? Thank you again. Congratulations to the class. Thank you, P&G and the American College.